So now we are going to study about the urinary bladder. So what is urinary bladder? So urinary bladder is the storehouse for a temporary storage for urine. It is a muscular organ which is situated in the pelvic cavity. It is tetrahedral in shape and so it is situated in the behind the pubis symphysis. So it can be either when it is empty, it is tetrahedral in shape like that you can see here. So it is tetrahedral and it has apex, which is this one, then the base or the posterior surface. This is the posterior surface is called as a base. And this is the inferolateral surface. So there will be two inferolateral surface on the two sides. This is the apex, base, two inferolateral surface. This is the superior surface and this is called as the neck. So these are the external features of urinary bladder. And when it is full, it becomes ovoid and it has only anterior and posterior surface. So these are the external features of the urinary bladder when it is empty, and when it is full it will be ovoid in shape. So the shape changes according to the content of the urine in it. So we have seen the shape and the external features or the presenting features. Now what is the position? It is situated in the pelvic cavity just behind the pubis symphysis when it is empty, and when it is full it becomes an abdominal organ. This will come just behind the anterior abdominal wall and the superior surface is covered with the peritoneum. But when it is full and becomes abdominal organ, the peritoneum again goes higher and the anterior surface will be in direct contact with the anterior abdominal wall. So if we pierce the abdominal wall with any scope, then we can directly enter into urinary bladder without piercing the peritoneum. So this is superior surface. So these are the external features. So what we are going to see about the urinary bladder, the external features, size, shape, position, then arterial supply, venous drainage, lymphatic drainage, nerve supply, and then lastly the applied anatomy. So first of all we have covered with the external features and it will differ for both empty and the full bladder. Then next is we have also seen the position. The position of empty bladder is in the pelvic cavity. But when it is full, it becomes abdominal organ. Also the shape also changes according to the content of the urine. When it is empty, it is tetrahedral. So it has four sides, one, two. Then on the other side, there will be one more inferolateral surface. So two inferolateral surface, one superior surface, and one posterior surface. So these are the four surfaces. So it is a tetrahedral in shape. This posterior surface is also called as a base of the bladder, and this is the neck. So these are the, we have seen the shape, then position, then uh, this is the apex. This gives attachment to the median umbilical ligament, which is the obliterated urachus, which is attached to the umbilicus. And this is the neck, which is the constricted part. And here, in case of males, there will be prostate, which is a hard and spherical mass at the neck. So with this, you can identify whether it is a male bladder or a female bladder. So generally, this urinary bladder is given to you in your viva, and you will be asked, is it a male bladder or female bladder? So you have to keep it in position with this base posteriorly, apex in front, and see whether the neck has this prostate, which is a hard spherical organ at the neck. So if prostate is there, it becomes a male bladder, and if it is not there, then it becomes a female urinary bladder. Okay, so this is about the size, shape, and position. Now let's see what is the capacity of this urinary bladder. So the capacity is nearly 250 ml. So when it is 220 ml, we feel for the fullness of the bladder, and when nearly it is 250 ml, the evacuation is done. So nearly 250 to 350 ml urine is evacuated when it is full up to this limit. When it is 500 ml, the urine is there in the urinary bladder, then we can feel the fullness or pain, and if it goes more than 500 ml, then the bladder can rupture. So this is the capacity of the urinary bladder. So capacity is normal is 220 ml. Okay, and it is evacuated. After that, we feel the desire for maturation, and it is evacuated mostly as a when it is 250 to 350 ml full. Okay, and when it goes up to 500 ml, then the person can hold the urine up to 500 ml. He will feel the pain, but he can hold. But after that, there will be danger of rupture of the urinary bladder. So this is about the capacity of the bladder. So we have seen the external features, all the surfaces, and then the apex, neck, and all the surfaces. Then next we will see what is the relation of the urinary bladder. So this is the section of sagittal section of male pelvis. So in front, this is the pubis symphysis. Behind that, there is a urinary bladder, and behind this urinary bladder, there is rectum in case of males, and at the neck you can see this is the prostate. So this is a male pelvis with a sagittal section. So as you can see, it is nearly 3 to 4 centimeters behind this pubis symphysis. So superior surface of the urinary bladder is covered with the peritoneum, and then this peritoneum covers the small upper surface of the posterior surface of urinary bladder, and then it is reflected on the rectum. So this pouch of peritoneum between the urinary bladder and rectum is called as rectovesical pouch. Okay, so you can see here, this is the rectovesical pouch. So in case of the urinary bladder below, you can see this is prostate, and then this is urethra. This urethra is large in case of male, it is nearly 15 to 20 centimeters long, and in case of females, it is 3 to 4 centimeters long. It is short. Urethra is short in case of females. Now this urethra is attached to this, means continuation of this at the neck of the urinary bladder. So the urine will be evacuated from this urinary bladder into urethra, and the sphincter is situated inside this wall of the urethra. Like in case of pylorus of the stomach, there is a sphincter at the end of the stomach, but in case of urethra, there is no sphincter here. Okay, so it is situated in the wall of the urethra. This is called as external urethral sphincter. And in case of males, just above this prostate here, there is a collar like arrangement of the smooth muscle, which is called as internal urethral sphincter. Okay. So the internal urethral sphincter is here above the prostate, and the external urethral sphincter is in the wall of the urethra. And this external sphincter is controlled voluntarily, and this internal sphincter is involuntary. So there are two sphincters, internal urethral sphincter and external urethral sphincter. So this is about the male urinary bladder and male pelvis sagittal section. Now we'll see the sagittal section in case of females. So in case of females, sorry, the diagram is missing here. So we can imagine that in case of females, behind this urinary bladder, here there will be the uterus and vagina. So the posterior relation of the urinary bladder will be the upper part of cervix here, and this peritoneum will be reflected from the superior surface of the urinary bladder on the uterus and vagina, and then from the uterus and vagina onto this rectum. So there will be two pouches of the peritoneum, that is vesico-uterine pouch. Okay, vesico means the urinary bladder and uterine. So vesico-uterine pouch, which is also called as a pouch of Douglas. And there will be utero-rectal pouch. So there will be two pouches in case of females. Now we will see. So this is the this we are seeing the urinary bladder from the inferior aspect. This is the neck of the urinary bladder and this is the opening of urethra. These are the two inferolateral surfaces and this is the posterior surface or the base. And the apex is attached, give attachment to the median umbilical ligament, which is nothing but the remnant of urachus. So this is the we are seeing the bladder from the inferior aspect.
थोडंसं मन मग बोल ना प्लीज.
So we have seen the superior surface of the urinary bladder, relations of the superior surface. Now we will see the relations on the posterior surface of the urinary bladder. So this is the relations of urinary bladder posterior surface in case of males. So in both the males and females, the upper part of posterior surface only will be covered by the peritoneum, and this will be reflected above as a recto-uterine pouch in case of males, and in that pouch there will be the coils of small intestine. So posteriorly upper part is covered with the peritoneum. Then you can see there are two vast differences. Okay, so these are the two vast differences, and this is the seminal vesicle. So posterior surface of urinary bladder is related with upper part with the peritoneum, then middle part with the vast difference and seminal vesicle. This duct of the urinary, this seminal vesicle and the vast difference, due to this to unite and they open into the urethra, which is inside this prostate. So that is called as prostatic urethra. So this duct will open in the prostatic urethra. So and on the lateral surface, here on the lateral side of this posterior surface, you can see there is opening of ureter. Now when this urinary bladder is empty, the distance between the two ureteral opening is called as is nearly 2.5 centimeters. And when the bladder is full, this difference is 5 centimeters. So these are the relations of the posterior surface of urinary bladder. Okay, do you understand? Are you understanding? So superior surface is related with peritoneum and it will form the recto-uterine pouch, and in that pouch there will be the coils of small intestine. Posterior surface is related to peritoneum in the upper part, then vas deferens and seminal vesicles, and in the lower part you can see this is the prostate in case of males. So these are the relations on the posterior surface. Anterior surface will be behind the, you have already seen in this diagram, anterior surface is behind this pubis symphysis and this is called as retropubic space. So there is a retropubic space of Iridius between the symphysis pubis and urinary bladder. So this is the relations anteriorly. We have seen superior relation, anterior relation and posterior relation. Inferiorly, the neck of bladder will be related to prostate in case of males. And in case of females, there will be only short urethra which opens into the vagina. So these are the true relations of visceral relation of the urinary bladder. Now we'll see the peritoneal relations. So peritoneal relation also we have already seen. Only the superior surface and some part of posterior surface is covered with the peritoneum. Rest is related with the other structures that we already covered. Now we'll see the ligaments of the urinary bladder. So the ligaments, there are two types of ligaments, true ligaments and the false ligaments. So true ligaments are the, this is the lateral ligament, and so this is the anterior aspect, this is posterior aspect. This is the sagittal section of the pelvis, sorry, this is the horizontal section of the pelvis. Posteriorly this is sacrum, anteriorly this is pubis symphysis. So just posterior to pubis symphysis, there will be urinary bladder. Then in case of females, there will be uterine cervix, and behind there will be rectum. In case of males, this uterus and cervix will not be there. So behind the urinary bladder, there will be rectum. So we will see the ligaments here. So the ligaments are posterior ligament, then lateral ligament, which is attached to the urinary bladder and then laterally to the pelvic fascia, and the puboprostatic ligament, medial and lateral puboprostatic ligaments. So these are attached from the urinary bladder to the pubis symphysis. So these are called as the true ligaments of the urinary bladder. Okay, medial and lateral puboprostatic ligament, lateral ligament, and the posterior ligament. And the venous plexus, which drains the urinary bladder, lies in this posterior ligament, which is called as a vesical venous plexus. Okay? So there are three ligaments, which are two ligaments: medial and lateral puboprostatic ligament, lateral ligament, and the posterior ligament. These are the true supports of the urinary bladder. So these are called as a true ligament. Now there is one more ligament, which is a false ligament, which is actually not a ligament, but it is just a fold of peritoneum. So it is called as a false ligament. So the false ligament are the median umbilical ligament, which we have already seen here. Medial umbilical ligament is attached to the this apex of the urinary bladder to the umbilicus, and it is nothing but a fold of peritoneum. So similarly, there are two more folds of peritoneum which is attached, which is called as medial. So this is medial, and there are two medial and then lateral umbilical ligament, which are nothing but the folds of peritoneum. So it is actually not a ligament, it is just a fold of peritoneum. That's why we call it as a false ligament. So there are two types of ligament: true ligament and false ligament of the urinary bladder. So these are the ligaments of the urinary bladder. Now we will see. So this is the pubis symphysis. This is puboprostatic ligament, inferior lateral surface of the urinary bladder, and obturator fascia, and this is the vesical vessels and puboprostatic ligament. So this act as a support for the urinary bladder. So here again you can see this is the obturator internus muscle and levator ani muscle on which this urinary bladder lies, and these ligaments are attached to it. So all this gives support to the urinary bladder. Now let's see the interior of urinary bladder. Now this is the most important slide. See, this is also asked in your vivas, and this is very important to write in your exams. So this is important for both theory and practical exams. So when we see the interior of the urinary bladder, the interior is completely folded, because membrane is folded, and that is called as a rugi, means the mucosal folds. Like we have seen in case of stomach, the mucosal folds. Have you seen the mucosal folds of stomach? So like
Yes,
that,
ma'am.
there are mucosal folds inside this urinary bladder. But only small triangular area doesn't show any folds because it is firmly attached to the muscular membrane underlying it. And that triangle is called as trigone of the urinary bladder. Okay. So when we take a section of the urinary bladder and when we see the interior, we can see there are lot of mucosal folds, but a small triangle which is smooth and doesn't show any fold, and that is called as a trigone of urinary bladder. This can
फोन
also be
कॉल पे
asked in your MCQs. What is the trigone and what forms the 3 points of this triangle? So what is trigone? Trigone is nothing but a triangular smooth area inside the urinary bladder where the mucosa is firmly attached to the underlying muscular membrane. That's why we cannot see the mucosal folds there. Now what are the 3 points of this triangle? So these 2 points, these are formed by the openings of the ureter. Okay. So you can see the urinary bladder, the ureter. The ureter is attached above to the kidney, right? So this ureter will carry the urine which is formed by the kidney inside this urinary bladder. So it has to go to the urinary bladder. So here it will pierce the wall and it passes submucosally and opens here on this angle of the this trigone. So two ureters open at these 2 points of the trigone. And you can see the mucosal fold here, which is nothing but the submucosal ureter, which is passing through the mucosa of the urinary bladder. So these two are the ureteral opening, and there is a thick line joining the two openings of the ureter, and that line is called as interureteric ridge or bar of Mercier. This can be asked in your MCQs. What is bar of Mercier? So what is Mercier's bar? It is the interureteric ridge. Okay, interureteric means between the two ureteral openings in the urinary bladder. Okay, so two openings of the ureter, and here the apex of the triangle is formed by the urethral opening. Okay? So this is the urethral opening. Now in case of males, there will be an elevation at this urethral opening posterior to it, that is formed by the median lobe of the prostate, and that is called as uvula vesicae. Okay, so this can also be asked in your MCQ. What is uvula vesicae? So uvula vesicae is the median lobe of prostate which forms an elevation on the posterior aspect of the urethral opening in the urinary bladder. Okay, so this forms a third point. So these three forms a trigone. Okay, so this is the trigone. Now this urethral ridge is called as Bell's bar. So this is the Mercier's bar between the two urethral opening, and between the urethral and urethral opening, this is called as a Bell's bar. And this is the internal urethral sphincter, which is formed by the smooth muscles which are like a collar, forms a collar around this urethral opening. And then this is the prostate, and here there is the opening of the seminal vesicle and the vas deferens together. So that is called as seminal colliculus. This is the prostate. So this is about the interior of the urinary bladder. Is it clear? This is most important diagram of this lecture, interior of the urinary bladder. This you should know in detail for your viva, your MCQs and theory also. Okay. Now let's go to the next slide. Now what is the, let's move on to the blood supply and the venous drainage of the urinary bladder. So urinary bladder, it is supplied by the superior and inferior vesical arteries, which are the branches of internal iliac artery, which is a terminal branch of uh, this abdominal aorta. It terminates into two branches, that is common iliac artery. The common iliac artery has again two terminal branches, internal and external. The internal iliac artery gives superior and inferior vesical artery which supplies this urinary bladder. In case of females, inferior vesical artery is instead of that artery there is uterine and vaginal arteries. And in case of males, in along with these arteries, there can be internal inferior gluteal artery and pudendal arteries which supply the urinary bladder. So this is the arterial supply. Now the venous drainage, the veins form a plexus which is called as a vesical venous plexus. This vesical venous plexus, it lies in this ligament which is the posterior ligament, and finally it drains into the vesical veins drain into the inferior vena cava, and the inferior gluteal and superior vesical venous plexus into the, finally into the iliac vein and then into the inferior vena cava. So this is about the arterial supply and the venous drainage. The lymphatic drainage, it finally goes into the vesical lymph nodes and then into the lateral aortic group of lymph nodes. Now then one more important thing is the nerve supply of the urinary bladder. You can have a separate question on nerve supply of the urinary bladder. So urinary bladder, it is supplied by sympathetic, parasympathetic and somatic nerves. Now sympathetic nerves, Sympathetic is by the T11 to L2. Okay, so this is the sympathetic nerve supplying the urinary bladder. This sympathetic nerves, it forms the hypogastric and vesical plexus, and it is inhibitory to the detrusor muscle. This diagram may be there in your books. So you understand here what is the meaning of this diagram. So negative means it is inhibitory to the detrusor muscle. What is detrusor muscle? The muscles of the urinary bladder are called as a detrusor muscle. And inhibitory means what? It will inhibit the contraction of this muscle. Okay, so it will inhibit this detrusor muscle, and it will activate the sphincter muscle. So activate means what? The sphincter will be again constricted. So what will be the effect of this? If the sphincter is constricted and detrusor muscles are not able to contract because of sympathetic, so the urine will be hold into the urinary bladder. So there will be holding of urine because of the sympathetic nerve supply. Now the parasympathetic. The parasympathetic is by S2, S3, S4, and this is called as a pelvic splanchnic nerve, or also called as a nervi irrigans. Okay. Now this parasympathetic also goes to this along with the vesical plexus, and this will be positive means it is motor to the detrusor muscle and inhibitory to this internal urethral sphincter. Now what is meaning of this? So detrusor muscle, motor to detrusor means it will bring about the contraction of this muscle and inhibition of the sphincter. So what will happen if the detrusor muscle bladder is contracting and sphincter is relaxed? Then what will happen? There will be micturition, right? So the parasympathetic brings about the micturition, and sympathetic brings about the holding of the urine. I will once again repeat this because this is very important. The parasympathetic is, so parasympathetic is, so the parasympathetic is brings about the micturition. It will bring about, it is motor to the bladder muscles, that is the detrusor muscle, and inhibitor to the sphincter. So it will bring about the contraction of the urinary bladder and relaxation of the sphincter. And because of this, there will be micturition. And sympathetic is, hello, can you hear me? Hello.
Yes,
Yes,
ma'am.
yes, ma'am.
So are you understanding what is sympathetic and parasympathetic?
Yes.
Yes.
Yes, so parasympathetic is motor to the detrusor muscle. So it will contract the urinary bladder and relax the sphincter. So this will bring about urination. And sympathetic is T11 to L2. So this will be inhibitory to the detrusor muscle. So it will relax the detrusor muscle and contract the sphincter. So this will bring about the holding of the urine. So sympathetic is supplied by the T11 to L2, and it will bring about the holding of urine. And parasympathetic is by S1, S2, S3, S2, S3, S4, that is nervi irrigans, and it will bring about the micturition. Then third is the somatic nerve supply is by the pudendal nerve, and this pudendal nerve, will be supplying the pudendal nerve supplies this external urethral sphincter, which is a voluntary sphincter. So S2, S3, S2 to S4, this supplies the parasympathetic supply, also gives somatic nerve supply to the external sphincter. So because of parasympathetic, this S2, S3, S4, when it is activated, because of parasympathetic, the this act of micturition start here, and when there is a pudendal nerve acts, then this sphincter will be then only when this pudendal nerves activate, then only this there will be voluntary micturition. So this is about the micturition. So when this parasympathetic is damaged, then there cannot be normal micturition. Okay, so parasympathetic is very important to bring about the micturition. Okay, so sympathetic is T1, T11 to L2, it is for holding the urine, and parasympathetic is S2, S3, S4, and it is for the micturition, and the voluntary supply to the external sphincter is by the pudendal nerve. So this will bring about the voluntary micturition along with this parasympathetic nerves. This internal sphincter is not supplied by the somatic nerve. So it is involuntary. Internal urethral sphincter is involuntary and the external sphincter is voluntary. Okay. So when there is a spinal shock, if these nerves are cut, then what will happen? This voluntary
No
response,
micturition.
there will be continuous dribbling of urine. First of all, this bladder becomes flaccid because these nerves are not acting, so it cannot contract. So it will fill to its maximum capacity, and when its limit is reached, then there will be dribbling of the urine, and that is called as autonomous bladder. Okay. So, and this sensation is carried by the pain sensation from the bladder is carried by the lateral spinothalamic tract. What is lateral spinothalamic tract? It is further pain and temperature sensation from for all the body. So like that, the pain temperature from the bladder also is carried by the lateral spinothalamic tract, and the distension of the bladder, the sensation or the feeling of the bladder, it is carried. This feeling is carried by the posterior column, like the other sensation, which are carried by the posterior column. The normal sensation from the bladder is also carried by the posterior column. So when there is a complete transaction of the spinal cord, then there will be no sensation carried, and that will lead to the autonomous bladder. So this is the clinical anatomy. Now, what are the other points of clinical anatomy? First is cystoscopy. We can view the interior of the bladder by cystoscopy. Cystoscopy means what? We to put a probe inside the urinary bladder. So there can be two methods of putting a probe into the urinary bladder. So one is through the urethra. Okay, so through the urethra you can put a probe into the urinary bladder and you can see the interior. Second is when you put some liquid inside the urinary bladder and it becomes abdominal organ, then you pierce the anterior abdominal wall and reach inside the urinary bladder. So that is called as laparoscopic cystoscopy. So through urethra, second is through laparoscopic, and third is during operation when you remove the anterior abdominal wall, you can see the interior. So these are the three methods for visualization of the interior of urinary bladder, and that is called as a cystoscopy. Now the next applied anatomy is this urinary bladder. It has a very concentrated urine, so it can be lead to the formation of stone inside this urinary bladder. Then so this is about the applied aspect of urinary bladder. Now, what can be the questions asked on the urinary bladder? Interior of the urinary bladder, short note. Then complete question on the urinary bladder, external features, interior, nerve supply, arterial supply. Long question on that. Or only nerve supply of bladder, you can have a short note. So in that you have to write sympathetic nerve supply, parasympathetic, somatic nerve supply, and the clinical aspect when there is a what is flaccid bladder, what is autonomous bladder, what is automatic bladder. So this is about the nerve supply of the urinary bladder. And in Viva also you will be asked, you will be given this organ in your hand and you have to first identify the organ. So you have to see the two urethral openings and see the prostate. So with prostate you can identify whether it is a male or a female, and you have to show the interior, the internal muscular folds, trigone, what are the three borders of the trigone, what is uvula, psyche, Mercier's bar, and what is the bar of it. So these are all the questions asked on the urinary bladder. Okay, so any questions?
No, ma'am.
Okay, so you can read this topic, and if you have questions you can ask me in next lecture. And when you come to college we will see this organ in your dissection. Okay, so that's all for you. That's all for now. Thank you. Stay home, stay safe, and utilize this time for reading, because you will be having a short of time when you come back and join the college, and there will be very less time for your exams. So if you prepare now, it will be very good for you for your exams. Okay, best of luck. Prepare this topic and let me know if you